Good morning. Welcome back. 8:11 on your Wednesday morning, and we're sitting down for a Fox 4 house call with Dr. Andy this morning. Good morning to you. So in the news lately, we've heard a lot about Andrew Speaker and this tuberculosis and its drug resistance. So I think a lot of people are kind of on edge wondering, could something like this affect us in the local area? I mean, is this something common that we could see here?
It's actually very uncommon. One of the reasons they call it extreme drug resistant or extraordinarily drug resistant tuberculosis. It's right now only found in certain places in the world, although, as we saw last week, it only takes an 8-hour plane ride for something to get from someplace else in the world to here.
Right, to kind of travel. So
exactly.
I guess first and foremost, since we're talking tuberculosis, what exactly is it, and what are the symptoms of it?
Good question. Tuberculosis has been found in skeletons as far back as 3000 BC.
Wow, so it's been around.
It's been around a long time. It's caused by a bacterial infection of the lungs, and it can spread through the body, but it's mostly in the lungs. And it's spread through respiratory droplets, coughing, sneezing, talking, and not washing your hands, and then come in contact with somebody else.
Okay, so how would you know if you had it? I mean, is it just something as simple as a cough?
Well, the people most likely to come in contact with it today in Southwest Florida are people who work in law enforcement, people who work as teachers, people who work with large immigrant populations like construction or migrant farm workers, for example, and healthcare workers. And so if you have a coughing illness that's not going away after several weeks, you probably need to get a skin test. And in fact, we all in those job fields are required to get skin tests on an annual basis for that reason.
So when you say a skin test, they actually put like a little bubble in your skin, don't they?
Exactly. It's something that I certainly do occasionally as well, and I get it done. Also, it's a little injection under the surface of the skin of a reactant, and if your body reacts to it, then you have tuberculosis.
Okay, so a lot of people on edge hearing about this case, and even just hearing tuberculosis, I think people get a little nervous. Is it treatable if you find out you have it? Okay.
Absolutely. And more than 90% of the time, it's curable.
Oh, good. Good to know.
There are lots of good drugs out there.
Now, and you talk about getting tested, when you work in specific fields, but do you recommend that just your average Joe out there, any of our viewers, get tested on a regular basis for it?
Yeah, the average screening right now recommended by the U.S. Preventative Health Screening Task Force is actually a verbal history examination. Okay. So you may not know you're getting screened for tuberculosis when your doctor asks you if you've been traveling anywhere or have you been feeling sick lately, but that's exactly what we're doing when we ask you those questions, is screening for tuberculosis.
Okay, so good to know, nothing really to worry about, and just if you have a cough, get it checked out by your doctor.
Absolutely.
All right, thanks a lot, Dr. Andy, and if you want to get in contact with Dr. Andy, maybe you have a question for him, you can email him at DRAOL, Dr. AOL, at phd-md.com, or give him a call, 239-694-6246. Thank you so much.
Always a pleasure.
See you next week.